Hello, everyone, and welcome to this online course about the requirements for a management system for quality in a healthcare organization. This course is intended to give you a detailed presentation of ISO 7101, the standard published by the International Organization for Standardization in 2023, with the purpose of establishing a baseline for what means quality in health services and quality management in healthcare. My name is Mohammed, and I will be with you for the next hours as we will dissect together the provisions of this standard, and we will try to understand which are the aspects that a healthcare organization should focus on if it wants to establish an effective quality management system. Disclaimer: I must tell you from the beginning that I am not a doctor. I don't have a medical background. However, I do have relevant experience in auditing and implementing quality management systems, participated in preparing the Sustainable Green Hospital Standards with the General Authority for Healthcare Accreditation and Regulation in Egypt 2021, and also participated in reviewing the 7101 specification when it was prepared in 2022. I did many audits in healthcare organizations, and medicine is and always was a subject present in my everyday life since I am an environmental consultant for many hospitals and healthcare organization, and I use their doctors' experience and their knowledge for clarifications and for explanations on specific medical issues when I created this course. Now, let me tell you a few things about the structure of the course. Basically, we will follow the requirements in ISO 7101, and after an introductory section where we will discuss generic aspects about what is a quality management system, why would an organization want to implement such a system, or what is the structure of the standard, we will start our detailed analysis of the requirements for this management system with the fourth clause of ISO 7101 that is called Context of the Organization. We begin our journey through the provisions of the standard from clause number 4 because this is where the first requirements are. The first three chapters in the standard do not include requirements. Here in this table, we have the structure of the course. There are 8 sections, and apart from the first, the sections relate to the clauses of ISO 7101, where we do find requirements. This means clauses or chapters 4 to 10. I will give you all the necessary information about the structure of the standard a little later. As I said, we will begin with an introductory part to the course where we will discuss generic information about quality management in healthcare, and then we will focus on our standard on ISO 7001 to understand what is its purpose, who can use it, or how it is structured. Quality management in the healthcare sector. Before we can discuss about managing quality in an organization, be it a healthcare organization or not, we should first look to understand what quality represents, what this concept is about. Of course, we all have our own understanding of what quality means, but this is usually a subjective opinion. What is a quality service for one individual may be very, very different from what means quality to another, and it's the same for products. The simplest way to prove that is by looking at the reviews for a product or a service. For some people, a certain product may be worth 5 stars because it meets their requirements, while for others, it can be a bad product because it is not what they expected. So it's not that easy to find the definition for this concept quality. But of course, we do have such a definition. We have it in another standard, not in the one that we will discuss during this course. We find the definition for quality in ISO 9000, and it says that quality refers to the degree to which a set of inherent characteristics of an object fulfills requirements. And the first requirements that come to mind are, of course, those of customers. It's true that those are generally the most important requirements to consider when judging the quality of a product or service. But it's not only about customer requirements. There can be legal or regulatory requirements, for example, that apply to a product or to a service. There may also be requirements coming from different stakeholders, which are not the customers or the direct users of that product or service. There can be also internal requirements of the organization placing that product or that service on the market. So, quality is not exclusively about meeting customer requirements. It's about requirements in general that are relevant to the product or to the service in question. Now, what does it mean for an organization to manage quality? It usually means to have the structures, the roles and responsibilities, the processes, the resources, the rules, and the controls needed to provide products and services that are expected to meet applicable requirements. Now, coming to our subject, managing quality in healthcare organizations, we should begin from the obvious, which is that each and every one of us has to deal with the healthcare system at some moment in our lives. And when we do that, we would expect quality services. In other words, services that will meet our requirements and expectations. Today, we all know that there are some significant challenges that put a strain on healthcare management and on the quality of care for patients. Among the challenges to delivering quality healthcare, we can include the ever increasing costs of medical services, workforce shortages, insufficient or inadequate equipment. Then, changing demographics is another challenge for the healthcare system. We live longer lives, but we require more medical assistance, especially in the last decades. Patient satisfaction is another challenge that the healthcare system must manage, and so is the case with the complex regulatory landscape. As the legislation and the regulations are getting more and more complex, keeping up with those evolving requirements can be difficult. The COVID-19 pandemic showed the limits of the healthcare system and how those limits can be easily reached. Okay, but can the adoption of a quality management system solve all those problems in healthcare? Of course not. Nobody claims that. But what can be done is to establish a baseline for what means quality healthcare services. This can help hospitals and clinics, but also insurance companies and authorities, and maybe non governmental organizations and agencies to understand what is necessary for a healthcare organization to be able to provide timely, safe, effective, efficient, equitable, and people centered care. Before I close this video and we move to the next subject, I want to discuss a little bit about the distinction between two of the concepts from this enumeration. The standard mentions about effective and efficient care. So, what is the difference between effective and efficient? Many times, those two terms are used interchangeably, but they have distinct meanings. And I think a quality management professional should know the difference. So, effective refers to successfully achieving a desired result, regardless of the effort or the resources used. Efficiency, on the other hand, is about achieving the desired result with the least amount of resources used or the least amount of time spent. Efficiency is not only about getting the result, but doing that while using a minimum amount of resources. That's the difference. If a task is completed correctly, but it takes more time and more resources than necessary, then this is effectiveness, but it is not efficiency.